Hello and welcome to Good Life, your weekly show on health and wellness. I'm Shu. In today's fast-paced life, irregular working hours, faulty eating habits and inadequate sleep are all a one-way ticket to cardiovascular dysfunctions. So what do you then do to avoid heart attacks? Well, surgery is not the only option. Tanya Bhardwaj now puts the spotlight on some non-invasive cardiovascular treatments.
I'm Balakrishnan Nambiar, a Kerala settled in Mumbai since last 35 years. During last Diwali, suddenly I started feeling suffocation and breathlessness. So 3-4 days I didn't take any notice because I thought it is pollution and because of the crackers. But when I could not sleep at all, I went to a general physician. So immediately he told me, get admitted in an ICU, you have some serious problem with the heart. There they diagnosed 4 blockages in the heart and my ejection, heart pumping force was only 20%. It was very serious. They said I won't survive for more than 20 days unless I do the surgery. After my angiography was taken, I was kept in the hospital for observation. One of the nurses asked me what was my problem, and I said I got 4 blocks. She said, don't go for surgery, there's a new method.
So what was this new method? Preventive cardiology offers a different approach to cardiac care. Emphasis is laid on reversing heart diseases with the help of non-invasive tests and therapies clubbed with lifestyle modifications like cardiovascular exercises and dietary regulations, all to help create a natural bypass.
Preventive cardiology focuses on prevention of the disease, which has 3 forms. One is the primary prevention, which is people who do not have disease. Secondary prevention is for the people who have got risk factors like blood pressure, diabetes, cholesterol. They are at high risk for heart attack. And tertiary prevention is for the people who have already got the disease. If they wish to avoid the surgeries and just with lifestyle changes control the disease, the milder cases, and to prevent the recurrence. Already the people who have got bypass and angioplasty, they are often told second surgeries.
After regular medical tests like an ECG, stress test and lipid profile, your preventive cardiologist could recommend dietary modifications and an exercise routine tailor-made to your needs. On the contrary, if you have a history of cardiac dysfunctions, you may have to opt for the non-invasive treatments like arterial clearance therapy or ACT. This therapy includes intravenous strips which are given to cleanse the arteries, making them more elastic and hence improving blood circulation. Another treatment available is EECP or Enhanced External Counterpulsation. Here you are made to lie down on a padded table where 3 large cuffs are strapped around your calf, upper thigh and lower thigh. These cuffs are inflated and deflated in synchronization with your heartbeat. During this process, the heart's natural mechanism of forming new vessels is enhanced, which increases the blood supply to the heart muscles. EECP involves 35 days of treatment, with each treatment session lasting for about an hour.
So before the treatment started, I could not walk properly without anybody's help, and my ejection force was 20%, which is very fatal. Now after the treatment, that has gone up to more than 50%, 50 to 54%. Now without anybody's help, I've traveled. I went to Cochin, came back last week.
Preventive cardiology is definitely the way to go, as it is lighter on the wallet. A 3-month intense package could set you back by about 10,000 rupees. But besides good economics, it also calls for a lot of resolve and dedication, as you might have to make a host of lifestyle changes, like giving up smoking, that occasional swig of alcohol, or your favorite butter chicken. Things that many people would not like to do. But isn't that better than a scalpel plunging into your chest?
Worldwide, preventive cardiology has helped about 80% of patients from going in for a bypass surgery or an angioplasty. So we strongly recommend that you take some time out for your own heart.